The process explained will be the physiological cause of cardiovascular diseases as well as their possible treatment. According to the World Health Organization, the world's leading cause of death is cardiovascular diseases. These correspond to all conditions related to the heart and blood vessels. Anyone living with high blood pressure is at risk of having the most vicious of them all, which is a sudden heart attack. Fortunately, there are various ways to alleviate the symptoms of this disease straight away, such as the use of aspirin or nitroglycerin. Before briefly describing the biochemical process of action of each of these drugs on the human body, it will be important to explain in length the physiology behind cardiovascular disease. The heart is a powerful organ that constantly pumps blood through the body through large elastic muscular blood vessels called arteries. With each heartbeat, blood from the heart chamber is ejected into the arteries, which are then naturally subjected to high pressure. However, a decrease in arterial lumen, as well as a decrease in the elastic capacity of these blood vessels, can hinder the normal functioning of this biological process. As a result, the unhandled pressure exerted by the blood on the inner wall of the arteries increases. This abnormally high pressure can then damage the internal arterial tissue, leaving a wound that will clot. The coagulation is extremely dangerous in the arteries, as the resulting blood clot could potentially block the lumen. If this happens, a heart attack is inevitable within moments. Now, a specific question hangs over us. What could possibly cause this fatal decrease in arterial lumen as well as this decrease in the elastic capacity of the vessel? Atherosclerosis is a disease characterized by the accumulation of fat cells on the inner lining of the arteries, reducing lumen. This fat deposition is caused by an excess of low density lipoprotein, commonly referred to as bad cholesterol. Smoking increases its blood concentration as well as the consumption of saturated and trans fat. On the other hand, physical exercise contributes to its decrease. Arteriosclerosis is a less specific medical condition that refers to the hardening of the arteries. This physiological process occurs when the muscle cells in the arterial wall will no longer receive enough oxygen to survive. This is usually caused by fat buildups that interfere with gas exchange. In the most extreme cases, the, the asphyxiated muscle tissue can no longer stretch at all. Aspirin, known scientifically as acetyl salicylic acid, is a medicinal molecule with multiple attributes. It liquefies the blood as well as the blood clots that could block the arteries. That's why heart patients often carry this type of medication with them. On the other hand, nitroglycerin allows vasodilatation of blood vessels, which is allowing a better circulation of the blood through the diseased arteries. Despite those biomedical and pharmaceutical advances, it's worth remembering that it will always be better and easier to prevent the onset of cardiovascular diseases than to treat them.